Thanks so much, Janice, and thank you to everyone for joining us this morning. So I'd like to tell you about some of the provincial work that's happening within AHS in partnership with the Pain Society of Alberta. My only disclosure is that I am employed by AHS and my position is funded by a grant from Health Canada's Substance Use and Addictions Program. So the first thing I'll do is give you a little bit of background on the Alberta Pain Strategy. So the Pain Strategy represents a collaboration between Alberta Health Services Strategic Clinical Networks and the Pain Society of Alberta. It outlines a coordinated approach to assess and manage pain across Alberta. The strategy is intended to be inclusive of the biopsychosocial spiritual approach to pain. It spans all ages, all pain classifications across the care continuum, and incorporates the quadruple aim dimensions of AHS, which include the patient and family experience, the provider experience, population health outcomes, and financial health and efficiency. So the strategy outlines three focus areas: acute pain, chronic pain, and opioid use in pain management. The Pain Strategy team includes a number of multidisciplinary working groups with members across Alberta, including patient advisors. And the team has been focused on implementation of the strategy since fall of 2019. Priorities of the Pain Strategy are aligned with the series of reports from the Canadian Pain Task Force, which was established by Health Canada to provide advice regarding prevention and management of chronic pain. The task force produced 3 reports that address the current state of chronic pain across Canada. They did extensive consultation and provided recommendations on actions to recognize and support people with pain to prevent and treat pain. One of the goals identified by the task force is that people living with pain and health professionals have the knowledge, skills, and educational supports to appropriately assess and manage pain based on population needs, and that the broader community understands pain as a legitimate biopsychosocial condition and that stigma is reduced. So the Pain Strategy team was awarded a Health Canada grant under the Substance Use and Addictions Program. The grant is focused on 2 main areas, one being acute pain management, the other being the focus of this presentation, and that's the education repository component. So these areas are consistent with the priority actions that were identified by those Canadian Pain Task Force reports. So the opioid crisis has fueled increased interest in pain, and people may be going online to learn more. We recognize that there is a lot of valuable information available, but it may be difficult for some to source out reliable and evidence-informed information on pain. It can be challenging to identify misinformation, a problem that's most recently been associated with pandemic-related misconceptions and subsequent harms. But the concept of misinformation isn't new. It's been 20 years since we met the House Hippo. If any of you can remember that public awareness campaign, it was funded by the Canadian government, and it was aimed at helping people to identify reliable information. Well, apparently the House Hippo is making a comeback, and if you have some time, the Media Smarts website is worth a visit. It's not affiliated with the Pain Strategy, but I think it's a really engaging site with lots of tips and tools. I also came across an article from 1993 discussing the difficulty in shifting public opinion away from the rest is best approach to low back pain. So the concept of misinformation isn't new, but what has changed is the volume of information we have access to as members of the public and as healthcare providers. So in response to these problems, the Alberta Pain Strategy prioritized the creation of a repository of evidence-informed and provincially consistent pain resources. That process started with a scan of available resources to see what is out there, and results of the scan were reviewed and important resources were selected by content matter experts from the Alberta Pain Strategy working groups. In addition, surveys were administered to learn about where patients, the public, and healthcare providers tend to look for health information, and this informed the selection of the 2 platforms to support, to host the resources. One of those platforms is My Health Alberta. That one is aimed at patients and the public. And pain information already exists in My Health Alberta, but there's no dedicated pain-specific page. So we are creating one that will be live in the fall. We asked our working groups to apply a standardized rubric to review existing My Health Alberta resources to make sure they are relevant and likely to be useful to users of the site. At this time, we don't have the capacity to create our own resources to help fill gaps, but this is something that would be helpful in the future. The other platform, which I'll show you in just a minute, is using the existing format for the Strategic Clinical Network's web pages on AHS's external website. So the Alberta Pain Strategy web page is public-facing. It's aimed primarily at healthcare providers who will be able to access the page from outside the AHS network as needed, no login required. So this is what our page looks like. There you can, I'm not brave enough to switch over to the live browser, so this is just a screenshot. But you can see over on the right-hand side, there's some key resources listed there, as well as those pain strategy reports that I mentioned, and coming events that are important to the pain community in Alberta and in Canada. There's some contact information there if you wanted to get involved with the pain strategy or if you have questions. And at the bottom of the page, there is a progress to date. So if you're curious about what's going on with the pain strategy, how things are going, that progress section will be continually updated. So I just want to explain that I've used the analogy of a conduit because the site is not intended to be an AHS-centric resource where you might find materials that are owned by AHS. Rather, it's a linkage to a collection of vetted sources where users might find information about their pressing questions. And here you can find the two ways to use the to access that new landing page. Because it's so new, unfortunately, the AHS network is temporarily blocking access to the site if you try to log in from within the AHS network. So if you are logged on to AHS, either in an AHS facility or at a remote workplace, you have to use the address at the top or navigate from ahs.ca using the series of clicks that are shown. It's much easier to get to the page from outside the AHS network, so on your personal device or from home, by using the address at the bottom, albertapainstrategy.ca. We are working on getting that, that glitch rectified, so hopefully it won't be too long before you can use that web address, whether you are within AHS or not. So that site will continue to grow and change as new resources are identified, so stay tuned. And that brings me to the end of my presentation. Thank you for your attention, and I will hand it back over to Diane and Janice. Thanks very much.